In this chapter, we will discuss the toxic effects of cyanide on the human body and the advanced medical techniques used for the treatment of someone experiencing severe overexposure to sodium cyanide. Here's what happens. Cyanide dissolves in the bloodstream and is carried to the body's cells. It has an affinity for cytochromes, which are mitochondrial enzymes involved in energy production at the cellular level. Cyanide interrupts the oxygen transport indirectly at the cellular level by attaching to the cytochromes, blocking the cell's ability to use oxygen to produce energy. The oxygen remains in the bloodstream as oxyhemoglobin. So how do the antidote therapies work to reverse the effects of cyanide? The nitrites, administered intravenously by a trained paramedic, nurse, or doctor, convert hemoglobin to methemoglobin. Methemoglobin has a strong affinity for cyanide and will extract the cyanide from the cytochromes. However, methemoglobin cannot bond with oxygen, so there must be a balance in the blood between hemoglobin and methemoglobin in order to supply oxygen to the cells versus removing cyanide from the cells. Medical literature recommends that methemoglobin levels be less than 30% of the total to prevent adverse health effects. Too much methemoglobin is called methemoglobinemia and can be fatal on its own at concentrations greater than 70%. Patients generally have excellent clinical responses to the first dose of sodium nitrite and rarely develop methemoglobin levels above 25%. Sodium thiosulfate provides additional cyanide detoxification, but does not act directly with the cytochromes. Instead, it works in concert with the enzyme rhodinase to promote conversion of cyanide to thiocyanate, which is much less toxic than cyanide and is naturally eliminated in the urine. Another commonly used antidote to reverse the effects of cyanide is the compound Hydroxocobalamin. Again, it is administered by a trained paramedic, nurse, or doctor intravenously to a patient showing the signs and symptoms of cyanide intoxication. The ability of oxygen to access the cytochrome oxidase enzyme present in the mitochondria inside cells is essential to the normal life-sustaining cellular respiration. When cyanide reaches the cells, it binds with cytochrome A3, a subunit of the cytochrome oxidase complex, blocking the oxygen and preventing the cell from being able to use it. Hydroxocobalamin binds with the cyanide to form non-toxic cyanocobalamin, a form of vitamin B12, which is then excreted in the urine, enabling the cell to use oxygen again. Cyanide antidotes are administered intravenously and require advanced medical skills in order to properly deploy. These antidotes must be administered according to their label instructions by a person properly trained in their use. Cyanide antidote kits commonly found in the United States are the Antidote and the Cyanco kit. These kits typically have a shelf life and special handling and storage requirements. It is important to follow the manufacturer's instructions. Important. Specific antidote treatment recommendations may vary by region or country. See the sodium cyanide safety data sheet for treatment in your region and consult with the nearest hospital emergency room and your doctor for antidote recommendations. If you are responsible for responding to a sodium cyanide incident, make sure you have adequate supplies of antidote kits and personnel trained to administer them. If you have further questions, please contact the Cyanco technical representative at the email address on your screen. We'd be happy to answer any questions you may have.